Hello everyone and welcome back to another video on the channel. Today the video is going to be a little different, and that's because I have this early access to Manus. I don't know if it's Manus AI's company gave me early access because I wrote the request letter. I wanted to see what it is, what the hype is about, because I was seeing all the news about how effective this AI tool is, and so I wanted to try it. And I did write an email about a few days after, maybe 4 or 5 days after. They sent me an email and they gave me early access. I already made a video based on the content of my channel about creating board questions for internal medicine practice, and that's on the channel. The link is there, you can watch. But now I wanted to do something a little different from what I usually do on this channel, which is a lot of medical education. So this is also medical education, but we're going to see how a Manus is able to create HNPs for us, and give it a sample case, a made-up case of a BPPV that I used GPT to create, and put it in Manus and see how it works. Okay, so we're gonna go through this together and see how it does. I haven't tried it in Manus before, and in fact I just they gave me only 1,000 credits, so I had to refresh the credits just to make this video. So if you guys like this video, enjoy it, please drop a like, subscribe, comment, notify. I'm gonna try to do a lot of medical related and medicine and AI in this channel, so hopefully you guys will enjoy. So let's get into it. So with every AI tool that I've worked with, the first thing I do, and I haven't done any of this with this Manus, is pretty new for me as well. I'm going to introduce myself to it and really tell it what I need. So the command that I would like it to do first, and I pre-wrote that so we don't have to sit here and type it, is: hi, I'm Dr. Nasser. I'm a hospitalist physician. I'm not, I'm a resident physician, but I'm gonna tell it that I'm a hospitalist for the purposes of this, and would like you to help me create comprehensive HNPs for admission of patients to hospital based on my conversation with the patients. So we're gonna kind of give it this, and let's see what it says. And I really like that it gives suggested new knowledge. This is something new. Let's see what it is. So it says suggested new knowledge. Knowledge enables Manus to learn your preferences and task-specific best practices. Manus will automatically recall relevant knowledge when needed. And I think GPT has similar to it. When you tell it specific commands, for example, say from now on do this, it will says memory updated, a little memory updated sign. And that has it, but let's see what it is about it, because apparently this is supposed to be really good at multitasking. So use when creating comprehensive history and physical documentation for hospital admissions. Content: create this HMP documentation for hospital admission based on the user's conversations with patients. The user is Dr. Nasser, is a hospitalist physician who needs assistance with documentation patient admission. So I could edit it if I wanted any differently, but I'm gonna accept. So this should go into it goes as a knowledge. So let's close it now. So now it's reviewing my comprehensive HMP guide to understand standard components and requirements. Using a browser, so it's going to even kind of look at what they need to do to document. So it's looking, so that's kind of interesting. Let's see what it's looking at. So it's going actually online, and I see it's working on a PDF. It's mind-blowing. And it's from meducsf.edu. Oh, it's interesting. It's actually going to, let's see what it looks like. Yeah, it's going through a whole sample HNP that it's finding. It even says right here that it's scrolling down, knowledge recalled. It's basically teaching itself what a comprehensive HNP is, which is kind of interesting to see. But in GPT, usually when you put that, it automatically has in its knowledge, I think, what an HNP looks like. But here, wow, this is interesting. So it's taken about like 1 minute and 59 seconds to do this. It's continuing to do that. Completing the research on HNP requirements and preparing to ask Dr. Nasser about a specific preferences. Oh, okay. It's very interesting. I don't want to keep saying this. Let's see. Updating the plan. All right. So it says let's see here. So Dr. Nasser, I've researched standard HMP components for hospital admissions and would like to understand your specific principle before creating a template. Could you please help me with the following questions? Does your hospital have any specific HMP format or an existing template? So we're gonna say 1, no. 2, it says, are there any particular sections of HMP that you'd like me to emphasize or expand upon beyond the standard components? We'll say no here. And then, do you have any preferences for how the assessment and the plan sections should be structured? Oh, that's good. So we're gonna say problem-based. But where I practice, we like system-based a lot in ICU cases. But I think as a hospitalist, probably problem-based would be the best. And let's see. So we said problem-based for number 3. And then 4, are there any specific, specialty-specific elements you'd like to include based on your patient population? Oh, that's interesting. So if you were a specialist and you're using it, there's this question. So we're going to say no. And then 5, it says, would you prefer a more concise HMP format or a comprehensive detailed one? What do we say? Comprehensive. And then we'll go from there. And let's tell it that. And then I have this made up patient here. So we're going to give it. So I'll now proceed with developing this template for your hospital admissions. So now it's working on creating the template. It's still using that, huh? Manus is working creating a standardized HMP report template. Which again, on GPT you can have this sort of conversation, but it doesn't really show you the monitor of how it is doing it. And I think technically you could do the same thing and really create a project on there, but with that I'll show you another video. But the GPT allows you to create projects and give instructions. You could do that, but this seems a little more personal. I like it. I'm liking how it works. And let's see what it's doing right now. Oh, interesting. Current progress. So this is actually how it's creating like a code for it. So let's see. Dr. Nast, I've created a comprehensive HMP template based on standard medical documentation practices with a problem-based approach to the assessment and plan. To proceed with creating an HMP document, I'll need specific patient information. Could you please provide details about a patient case you'd like to meet? Oh, okay. So it wants me to give him some information. Okay. Would you like to see this template first, or would you prefer to proceed directly with a providing patient? Let's see the template. And then we'll plug in my sample conversation. Oh, created a document. Wow. Let's preview the document. Okay, patient information. I don't want to have to move the camera there, so I'm gonna. All right, so it will put in MRN, DOB, age, gender, date of admission, time of admission, attending physician, chief complaints, source and reliability. What is that? Indicates source of information. Oh, from who coming? Okay, good. First sentence should include patients identifying. Okay, so it's actually very detailed. So we can actually gender. Okay, that's good. Chronological narrative of the development of patient's illness, including. Okay, that's nice. Onset, duration, progression. Very good. Previous treatments, patient thoughts and feelings, relevant elements of past medical history, family history, and social history. Okay. And past medical history is there. Surgical history will be there. OB-GYN history if applicable. Very good. Psychiatric history. Health maintenance, which would be the screenings. Oh, that's too comprehensive. And most hospitals will not have this. Medications, prescription medications, over-the-counter medications, supplements, allergies. Oh, that's good. Good. Habits. Okay, good. Home situation. Awesome. Yeah, all of that. And then it's got the review of systems. No, I think it's amazing here. All right, we got a lot of information. Very, very comprehensive. Okay. And then assessment plan will have the problem list, diagnosis problem, assessments, brief discussion of etiology, severity, and clinic reasoning, diagnostics, therapeutics, education, and disposition. Very good. So it's got all of that, and it researched that online. I think it took it from one of the websites we were looking at, and it looks pretty good. All right. Well, amazing. Okay. So now we're going to tell it that we're going to provide a conversation with a patient and see if it can create a sample HNP. All right. And again, just remember these AI tools are not really safe per se. They're not decoded. So if you're doing real patients, I don't recommend it. And I don't encourage it to put in patient information in these because they're not protected. And who knows who has access. So this is definitely not a good idea. But just for the sake of seeing how it works, we'll give it a sample random patient and go from there. And then it says there's some knowledge suggestions. So let's see. What are these? So it's giving more suggested knowledge for its learning. When creating HNP documentation, create this structure of assessment plan. Documentation should be thorough rather than concise. Okay. When provided with transcripts of conversations. Okay. Organize it into an HNP. Okay. And then these are the previous ones. Oh, awesome. Okay. Oh, one more pending. What is this one? Template. Oh, this is for the template. Oh, created its own knowledge. Wow. Okay, so let's see how good it is. And this is a sample transcript for a patient with BPPV, and we're going to put it right in here and see what it does. And you can use transcript and actually record your voice with a transcript in Act, and then plug it in there if you want to test it. But this is a good way. Let's see. All right, let's see how long it takes. And right now, let's see. Updating plan. So thank you for providing. I'll now extract the relevant clinical information and create a comprehensive HMP documentation based on this patient's conversation. I'll organize all the details following our template structure and present you with an HMP. All right, let's see how long it takes. Usually, shouldn't take more than a few minutes. Okay, so creating a file. Okay, it's gonna generate a file. It's good. I mean, it generated a file before too. Like, you could technically download this and you can copy PDF, you can preview, you can look at the code. This is great. This is really neat. All right, let's close this one. And it's I guess it's, if you view its monitor, it's what it's called. So it's plugging in the information. Oh yeah, it's current progress is working on it, and you can see as it's doing it. But some people may not care. But I think it's interesting. All right, let's close this. Oh, it's done. So it took 1 minute, guys. 1 minute for this. So let's see this document, and we're going to, let's expand it actually and see it. Okay, so it's got the patient information. Of course, this is all made up, all that stuff. I turned over in bed and suddenly felt like the room was spinning. So it put a chief complaint there. Information obtained directly from the patient. Patient is alert oriented and provides a clear history. Really nice. Reliable historian. Great. History of patient illness. Miss Holloway is a female who presents the acute onset vertigo that began Sunday night. The patient reports that while turning over in bed, she experienced a sudden sensation that the room was spinning. The episode was brief, lasting only a few seconds, but was described as intense. The patient reports that similar episodes occur primarily with positioning changes, specifically when lying down or getting up too quickly. She denies experiencing vertigo when sitting still. The vertigo is accompanied by mild nausea and no vomiting. The patient describes the sensation as the world titled for a moment, and states This current episode is more severe than previous episodes of lightheadedness she experienced in the past. So medical conditions not detailed. This was not in the transcript, so it left it empty. And they kind of provided HENT from the physical, reports chronic tinnitus, presents with a long time. Okay, no new hearing loss. It shows the neurologic exam, positive on the right side. Patient experienced vertigo with the maneuver, with the Dix-Hallpike maneuver, and reproducing symptoms. Brief nystagmus was observed by the physician. Okay, and data collection will be there if you have it. MRI ordered. Okay, let's see here. So problem list, BPPV assessment. Patient presents with the classic symptom BPPV, including brief episodes of vertigo, transition changes, particularly when laying down. Physical exam is positive for Hallpike. Plan diagnostic MRI ordered to rule out neurologic causes. B12 and thyroid function test ordered to rule out metabolic cause of dizziness. Therapeutic stuff, it recommends Epley maneuver. Physical therapy for vestibular rehabilitation, very good. Patient advised to avoid sudden head movement. Patient advised to sleep with head slightly elevated. Education, patient educated about benign nature of the BPPV. Okay, and then it has the chronic tinnitus as well, but it really put this is BPPV and chronic tinnitus. Okay, this position can be addressed follow-up patient if desires follow-up. And then there's a summary statement, which is good. In summary, this is a female patient with a history of chronic tinnitus who presents with acute onset positional vertigo. And all right, it kind of repeats it. And then the clinical presentation is consistent with PPV, MRI, and order to rule out other etiologies, though the clinical picture strongly suggests. Oh, okay. I mean, it's pretty good, and it was really fast. And although the the information that I gave it wasn't too much, it's all generated a very short conversation. But I did have a sample HNP for this same conversation created on GPT. And the GPT and assessment had the BPPV and the chronic imbalance, and it did have, okay, so it says ChatGPT basically likely right posterior semicircular canal, symptoms consistent of brief vertigo, initiate Epley maneuver, vestibular physical therapy, okay, educate the patient on positional precautions, and then they also have the chronic imbalance with fall risk, likely multifactorial. Check a B12 and TSH, bilateral heel spares. The patient had that, and then hypertension. I think a little more details on here compared to here, but I don't know. I don't think the conversation. Maybe they just generated some sample information here that is not in the conversation, because I don't think the conversation is too short. I think based on the conversation, actually it was really fast and it was very effective and to the point. I really enjoyed it, guys. Anyway, if you guys enjoyed this episode and kind of like an introduction to how Manus, here's another one, includes, so it says when provided the transcript of conversation, create comprehensive HMP documentation, BPPV, and other results will include details of about discriminant results, presence of nystagmus, and plan for. Okay, so we'll use this in the future. So basically, it's also learning medicine the way you would do it. I think maybe here the doctor said something about it. Let's see. That's interesting. Okay, yes. See, so physician says we're going to do a quick test called Dix-Hallpike. I'll help you later. So it actually is learning medicine. Wait. That is so cool. So you can actually see whenever you're evaluating for vertigo, like from your conversations with this patient, it will run. See, it says when creating this documentation, conversations about dizziness or vertigo symptoms, create a comprehensive documentation by extracting relevant clinical information and include the details about Dix-Hallpike maneuver results and presence of nystagmus and plans for Epley maneuver treatment and when applicable. So I guess it's based on this conversation. All right. And it's all the physician here telling this, and it's learning, and it wanted to add it to its launch. Oh, awesome. That's really good. Okay, so it even learns medicine from you. This is cool. All right. Well, if you guys enjoyed this video, please drop a like, subscribe, comment. Tell me what you guys would like to see in the future. Have any questions about this Manus AI or Manus AI? If you want me to run some other things, tests on it, we'll do it. But I'll continue to create more board review, sessions on different topics in internal medicine. I'll be using Manus a little more now to see how it works and kind of do compare and contrast. I feel like all of these AI tools have a certain, place for their use. And again, with medicine, it's a little tricky because we cannot technically put, we cannot we cannot put all of our trust in their knowledge. So it needs a very, whoever is going to use this, they need to use their own medical knowledge and medical training, because these are of course not as advanced. But writing the tasks that are repetitive and can be done, like writing an HMP from a conversation, those are very good. We can find these tools and see which ones are really good at this. But I really enjoyed this using Manus. We'll continue to try it out this month and go from there. Don't forget to click the notification bell for the future episodes. I'll see you guys on the next one.